𝗛𝗏𝗃, 8:10 a.m., Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗥𝗲𝗄𝗵 as we discuss the latest health and medical topics with doctors from 𝗥𝗲𝗄𝗵. For a healthier and uplifting lifestyle, tune into Healthline with 𝗥𝗲𝗄𝗵 on 𝗛𝗏𝗃, 8:10 a.m., Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗥𝗲𝗄𝗵, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search 𝗛𝗏𝗃 Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗥𝗲𝗄𝗵 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome.
Whoops, there we go. Hi, everybody, and welcome to Healthline with 𝗥𝗲𝗄𝗵. I'm your host, Nicole Jacinto. Today, we're going to talk about allergies, or the most common allergies in the Philippines. Now, if you want to get your questions in, do it and have your doctor answer them for you. Do it while the show is going on, and I'm sure you'll get your answers. As we say, you've got questions, we've got answers. So it's July 1, the start of a month. It's a Monday, and I'd like to say hello to all the viewers and listeners out there. Thank you for listening to Healthline with 𝗥𝗲𝗄𝗵 and all the other shows on 𝗛𝗏𝗃 8:10 a.m., Radio Bandido, and Radio Bandido TV, and all the other streaming platforms that we have. Okay, so hi, Doctor. Today we're here with Dr. Caroline Aquino. Thank you for joining us, Dr. Aquino.
Hello, good afternoon. Thank you for having me, Nicole, and for everyone who are listening here with us today.
Now, it's certainly my pleasure to have you on the show, and I've actually got so many questions. So you're gonna have to stop me at some point.
It's your show.
The information should come from you. Allergies is just a topic that I happen to know a lot about because I had to, know a lot about it. So I may go off on a tangent, but we'll try to stick to some basic things because we are talking about common allergies in the Philippines and probably amongst the Filipino population. So before we start off, can I actually, before that question, I have a question. How come some people say allergists and others say allergologists? Really just same thing.
Right. So from what I've heard from other allergists, allergology was like an old term. Mm-hmm. So allergist is just parang the newer term that they're using. I get international also when they their international conventions, they say she's an allergist. So, but either of the two, we know what you're looking for.
Yes. It's the same thing. I guess maybe because allergologist, there's an ology there, something like the word or logos, the study of allergy. And then, just so that probably people like me who are not doctors or medical professionals understand better allergist. Okay, got it, allergy. Okay, so Dr. Aquino, what exactly is an allergy? If you could tell us, what happens so people understand before we talk about symptoms and all of that.
Right.
Okay, sorry, go ahead.
How do I explain it? In simple terms, I guess when you say allergy, you develop antibodies to certain proteins. Example, dog hair. Most of us, we love dogs. They are really pets that most of us grew up with. But for some reason, some people just develop allergy to dog hairs or probably to their secretions. For some reason, your body develops what we call the IgE antibody to that. Let's say IgE antibody to the dog hair. So you develop allergies to the dog hair. When if you think about it, there's so many people with pets and just not everyone has allergies to it. What else? Dust mite, for example. Dusts are just there. And a lot of people work, diba, cleaning. Yes. But not everyone develops IgE to dust, but but some people do. No, so what that is allergy. No, that's why you say allergic ako dyan. It means you just develop antibodies to it. So every time you are exposed to it, your body have all these allergic
reactions, and those are the symptoms. Okay, thank you, doctor. So basically, an allergy, it's like an immune response system that your body develops, and it doesn't mean that that thing is actually dangerous for you, but for some reason your immune system, correct me if I'm wrong, jump in anytime, this is how I understand it.
Okay.
But for some reason our immune system, or the immune system of an individual, thinks that, hey, this is bad for you and it can kill you or harm you. So when it develops those IgE antibodies, and they're like T cells, am I correct?
Okay. No, actually, basically what happens is when you have your IgE antibodies to it, so when you are exposed to it, again, your body will develop all these different symptoms. No, usually the common allergic symptoms, kasi, di ba, we have one skin. Very common yung hives or rashes or wheals, di ba? Or sometimes you have angioedema, puffy. Yan. And then so you have your skin. Next, respiratory. Very common nose, no? You just all of a sudden you have sneezing, watery, yung sipon mo clear, no? And then you can have throat clearing and also coughing, difficulty breathing, yung worst case, like allergic asthma. And actually, the extreme allergic reaction that's really severe and an emergency is actually what we call the anaphylaxis, no? Kasi it's dito an anaphylactic shock. So, in a way, you're correct. If you think about it, ang allergy, hindi siya parang, sabihin mong parang mild. It's not really delicado, but actually it can be. Kasi it's anaphylaxis. Because remember, you have antibodies to it, your IgE antibodies to it. And the more that you are exposed to it, the more that they grow. So yung reaction mo over time increases.
I'm so happy you said that, because maybe we can circle back to that a bit later or keep talking about it, but there's a misconception about that. Okay, so I'll just kind of recap what you said, and again, jump in anytime, correct me if I'm wrong. So you may not be your body thinks it's harmful, so it developed antibodies. Like what happens when we're exposed or vaccinated for certain illnesses, right? We develop antibodies so that they can fight off the illnesses or the virus or whatever it is, the proteins of those things that enter our body, whether it's through the nose, the mouth, the eyes, or touching on the skin. And the more you're exposed to it, or when you get exposed to it, that's when you get the allergic reactions or the symptoms. And you mentioned a bunch of them. And maybe we can also circle back to that a bit later, because there, maybe people can't tell the difference sometimes when they have an allergy, or whether they have a cold already or a cough or something else. And okay, so the more I'm glad you said, the more you're exposed to it,
the symptoms worsen over time because your antibodies develop more.
Yeah, because they're like.
So there's no such thing as sometimes you're allergic to shrimp. Sige, you keep eating it.
Ayan, doctor. Thank you.
That's wrong. Actually, the study is if you're really allergic to it, every time you eat it, the symptoms should come out. It should always happen. So if that's the case, over time, it becomes faster and it worsens. So it's not true na you get exposed to it more, para hindi. In fact, over time, you'll feel na it's getting worse.
Yes, and that is a true allergy.
Yeah.
Doctor, you mentioned shrimp, no?
Yes.
I know some people who refuse to accept that they're allergic to shrimp. Yes, I'm talking to some family members here. And the thing is, okay, it could be that at one time you ate shrimp that wasn't clean because there are toxins in the shell, right? Like shellfish, it can cause like some people to vomit, or there's an intolerance because stuff like if you don't remove it or it wasn't cleaned properly, okay, we get. And then, because some people will say, how come I ate shrimp before, then I got allergic once and I ate it again, I'm okay now. Well, maybe that wasn't actually an allergy the first time, and maybe it was just like food poisoning, essentially. But if you can't just keep eating shrimp because it will get worse, or things like chicken or egg.
Yes, that's correct.
Okay, and so those are food allergies, and then
it should happen all the time you are exposed to it.
Okay.
Okay.
Yes.
So yun nga, you're correct in saying na pat ganon. Sometimes I ate shrimp naman before, pero this time I did. Actually now, in the recent conventions that we have one speaker, she's from Hong Kong, and now they're doing studies that actually they found out that shrimp actually cross-reacts with the dust mite component. So they have now studies coming up of patients who had a history of reacting to shrimp. But when they did the skin test or an allergy test to shrimp, it was negative. But when they did the allergy test to the dust mite, they were positive.
Okay.
So diba? So that's one of the newest development in the field of allergy, I have to say. Kasi before, that's what we'd always say is, if you're allergic to it, dapat every time you eat it, you will react. So may mga questions talaga, na ba't ganun, Doc? Pag napakain ako ng hipon and dumami. So now medyo may answers, because actually this study also focused on that they've noticed that I just forgot, like parang there are certain number of grams that you have eaten, and that's the time that you will react.
Yes.
But this is still an ongoing study, but I guess it kind of follows because there are other people who are also claiming that that's their history. So and it's well known naman that the shrimp has the same parang protein component with the dust mite. So that's one possibility. So that's what we're looking into. But in general, just to be specific, with anyone who claims that they have food allergy, dapat, if you really have a food allergy, every time you eat it, you should be getting the reaction. Not yung minsan meron, minsan wala. Then you have to think, is it really allergy? But that's correct. May possibility also with seafood, if it's not fresh, and it can really cause a bad reaction. But that's not an allergic reaction.
Okay. Thank you, doctor. And so we'll go to the symptoms just in a bit, because they can, they're similar, right? And people think, okay, so that's such a great piece of news, this new study, because then you see, we can start tracing why, and people amongst family will stop arguing. No, I'm just kidding. Because, okay.
Kasi we like eating, diba? So very important, if that person is really allergic to it, you have to make sure na you do not serve it, kasi it can cause a bad reaction and, ruin a very good family gathering.
Yes, and then rush you off to the ER, and then everyone is stressed out and drugged up with allergy medicine. Okay. So, speaking of allergy medicine, doctor, there are times when I want to focus when you mentioned on the antibodies, no? When we take allergy medicine, some of us are prescribed allergy medicine every day, whether it's actually, sorry, let's talk about the symptoms first. That way you can get into the, sorry. Okay. Just like so excited about this topic. Can you please come back on the show like many, many, many times? And, just because so many people are affected by it and we don't know, it's the allergies,
No problem. Okay, so regarding the symptoms, so as I've mentioned, there are different organ systems that are involved, but very common yun nga, the skin, no? So usually it's the hives or pantal or the angioedema, eyes and lips. And then very common with allergy, there is always itchiness. Makati po talaga. So ano yung difference niya? Hindi ko po alam kasi kung measles type of rash ba to, infection ba yung cause ng rash ko, or is it an allergy? With allergy, there really is itchiness. Usually they'll come in kasi kating-kati talaga sila. It's very pruritic, very itchy. That's one of the mediators. The histamine, that's why you take the antihistamine, because the histamine causes the itchiness. Next, for the respiratory, yun nga, you have your nasal congestion, matubig na sipon, watery rhinorrhea, and itchy nose talaga. And there's the itch. You can have itchy throat. And then for the lungs, you can have difficulty breathing or wheezing, like pwedeng asthma-like attack. Let's say hindi ka asthmatic, pero parang naging asthmatic ka, then it's actually a sign of anaphylaxis. So actually pwede. So those are common signs of allergy. Yeah, and they're usually immediate,
Yes.
Diba? What's the difference of an allergic? I don't know. Is it an allergic rhinitis or sipon? If I really see patients who are really diagnosed or they know they have allergic rhinitis, actually alam nilang i-differentiate. Usually an allergy like allergic rhinitis, may time in the wake, when they wake up, they have the sneezing, but later on during the day, wala na. And then with, of course, with the flu, you really bad, diba? You kind of feel down, and usually the sipon is full day. Tsaka yun nga, may body weakness. The thing with allergic rhinitis, kaya a lot of people can parang live with it, is kasi parang ano nila, it's a part of their daily routine. It really happens almost every day. Parang okay lang sila. Yun. That's the thing with the difference with an allergy and the allergic rhinitis and the common flu. Yeah.
Okay. Thank you, doctor. Okay, so that's clear to us. And also, doctor, indulge me if you will.
Yeah.
When you when you have rhinitis, also a doctor can, if it's bothering you too much, like every morning you will be like,
Yeah.
here with this tissue there, and then you're like, and then you know, a doctor can prescribe maybe like sometimes doctors will tell us you can use a nasal hygiene spray just to clean it out. It can help, or use something with the I'm trying not to mention the brand name. Okay,
Steroids for the nose.
the
Right.
steroid. Yeah, then you usually you do have to do it every day.
Yeah.
And there are also times when allergists like yourself prescribe let's say 10 milligrams of
Antihistamine.
antihistamine or cetirizine daily, because there's too many allergens around that we're exposed to. Like it's hard living in the Philippines. It is dusty. You walk out, you will get this. If you happen to react to pollution or a certain smell or anything, and when you mention dust mites, they're like, actually they're the things that eat dust. So we could be allergic to dust or the dust mites or the sheddings, right? The shedding of the skin. Okay, so when people are on allergy medicine, maybe I just you might feel like you're a bit weak sometimes, because it does make you sleepy, doesn't it? They're called antihistamine.
That's correct. Actually, especially some of the antihistamine, and that's their side effect actually. Yeah. So actually, there are what you call the second generation antihistamine that reduce the drowsiness. So not everyone actually feels the drowsiness. Pero yes, actually it's a common, or it's a known side effect of some of the antihistamines. Correct.
And then sometimes people like with our conversations, like, oh, maybe I should take it at night. The thing is, though, sometimes you're not exposed to it at night. It's during the day, but we live with it. When we take
it at night, is that hoping that when, let's say, you take it at night, para in the morning you're controlled.
Okay.
Para it blocks the immune receptors. That's the reason why. The idea, you take it at night, para when you wake up in the morning, you don't have symptoms.
Okay. And then the antihistamine. So basically, the histamine that our body or immune system response releases, that's what causes like the pantal, the the super runny nose, the maybe itching of the throat, other symptoms. And when we have too much of that in our body doesn't realize that what it's trying to push, the histamines that are trying to fight off the allergen that it thinks is dangerous for us, it can actually kill us, like when it gets to the level of anaphylaxis.
Yes. Pagka too much of the inflammation, it can lead to anaphylaxis. That's correct.
Okay. So there are people who will sometimes take let's say, okay, they know they're allergic to shrimp or crab or something, so they'll say, I'll take the antihistamine after I eat it. But I have been told that, listen, if you're really gonna do that, take it before you eat it. So that, how do you feel about that?
There are studies that said that actually the danger in doing that is that you do not know how big your reaction will be if you encounter that allergen. So, for example, you really like to eat seafood, but you'd notice that the past years you're having the itchies every time you eat the mga shellfish, shrimp, or crabs, no? Pero favorite mo talaga siya. So you took an antihistamine before going and eating it. You do not know this time around if the reaction will be so severe that your antihistamine that you took earlier cannot control it. Yun yung actually mas fearful, kasi it can lead to anaphylaxis pa din. Kaya still, the dictum is that if you know that you are allergic to it, just do not take it. Kasi you'll never know how big or how bad your reaction will be the next time you encounter it.
Thank you, doctor, because you keep exposing yourself to it. And like, let's say, okay, I'll take a couple of diphenhydramine hydrochlorides. The hydrochloride, or is that already branded? Well, it's off-branded, but it's just diphenhydramine. Okay. So God, it's Benadryl. Okay, fine. Like you should sponsor me, by the way, guys. Been taking you for a
But
long
that one can
time.
really make you drowsy, huh?
It can. But it's like one of the fastest reacting for,
Yes, yes.
and then the shelf life is
Short acting. That's why
shorter.
you can
Yeah.
take it like 3 times a day. That's correct. Yes, it
Okay.
still works naman. Correct.
Yeah. So, okay. So, you know, you just mentioned that it's not a good practice to do that. And I will tell you of someone, I didn't know her personally, but the allergists and people with allergies, that it was many years ago. And it actually happened again to a cousin of a friend of mine.
Okay.
So I hope she's not watching today, so she doesn't like get triggered and feel sad. But, knowing this woman was allergic to fish, and she had an EpiPen. We can talk
Okay.
about EpiPens later. So, because she would get an anaphylactic reaction, or it would just get so bad. But she wanted to eat it, so what she would do was just like, go out and eat fish, and then use her EpiPen, which you're not really supposed to just, use as a kind of, yeah.
Yes.
At one time, she went to a wedding, and she opened her bag after eating the fish, and she forgot her EpiPen. She died.
Oh, really?
She wasn't able to, they weren't able to get to her in time because the wedding was like in, a remote location with the celebrations and all that.
Yeah.
Yeah, and
Yes.
then also
Right.
with the cousin of one of my friends, she would take the antihistamines beforehand, and she just really wanted to eat the seafood and the shellfish, but it wasn't enough, and she died of anaphylaxis. So it was just really shocking. So
It's reaction, eh. That's the thing. Actually, then another thing, remember that not everyone has EpiPen.
Mhm.
Well, we have it here. In a way, we do have a supplier who we can buy from. So just contact with your allergist, but it's not like something you can buy in your local drugstore.
Yes.
All that you can prescribe, though, is having the epinephrine ampoule with you and a syringe.
Yes.
Mano-mano, no? You have to break
Mano-mano.
it. You'll get a 0.5 if you're an adult and inject it. So it's not like an EpiPen. You get it and inject on yourself.
Yes.
So actually, siguro for me, how I say it to my patients so they'll understand it more, an allergy is something that your body doesn't want. Ayaw niya yan. So they really reject that.
Mhm.
Ganun ka simple, diba? So,
Yes.
something that your body really doesn't want, and every time they encounter it, nagagalit sila doon. So just don't push it. I guess that's the of saying it.
Yes.
But I have to explain though that actually with allergy, there are some allergens, especially the inhalant, like you're allergic to, if you have dog allergies, dog dander allergies, or dust mite allergies, we can naman desensitize patients.
Okay.
So there is such thing as an allergy vaccine, or as a tablet for the dust mites, or an allergy spray that you can actually do. No, parang it's a treatment in a way. It's the closest to cure for these allergies.
Mhm.
Unfortunately, the studies right now are still for allergic rhinitis and allergic asthma. But for food, there are now studies in abroad. However, they have different protocols for food. At saka iba-iba. Like, kunwari, desensitization to egg is different to how they do desensitization from milk allergy. Parang ganon eh.
Yes.
So, talaga, if you're allergic to it, altogether we just say, remove it na lang. Unlike allergic rhinitis or allergic asthma for dust mites, dog danders, or cat hair, actually, medyo may chance pa.
Okay. That's good with the development of medicines and ways of desensitizing people to allergies. And then that, like, the dog fur or dog dander, actually Shih Tzus have hair, not fur, so they're a little bit less.
Actually, it's the same kasi parang even if what they have studied is that they still shed this. So as long as they still have hair, or they're actually now even in we do have a blood test that actually covers now even yung mga saliva nila, the other protein content, the other sources of protein ng mga pets. And they found out that you can also be allergic to it, no? Not on the dander. So parang there's really alam mo yon, just because kasi I know they say it's an hypoallergenic dog, but walang ganun eh kasi lahat ng dog they have.
And also, doctor, like, I understand with cats, what most people are allergic to is the saliva. not really the hair, but cats groom themselves all
So
the
in
time.
general, yes, most of
There's
their
a lot of
proteins parang mas allergenic sila actually nga raw, they say, compared to the dogs.
Mhm.
And actually, there are some studies before that they say na when you're born with a dog, you grew up with a dog, parang the chances of having an allergic reaction is rare. May studying ganon. Pero, I don't know, I still get some people who are allergic pa rin, or they eventually develop allergy. So, it doesn't really guarantee. To me, what I advise to my patient though, is that if you really like to have pets and you don't have symptoms naman of allergy or your negative skin test to it, have them in one area na lang, yung not always exposed to it, yung all the time.
Yes.
But sometimes the problem is they really live, most of them, diba, inside the house na gone are the days na the dogs are bantay.
Yes.
So,
And then,
problem. So, parang more exposure. So, yung risk of having more allergies, mas malakas tuloy.
yeah. Thankfully, I'm not like really that allergic to dogs. In fact, one of my dogs is snoring right now behind me. Okay. They are like co-producers of the show sometimes. They're really quiet when mommy's on the show. Like they know what's going on and they're listening to the doctor.
Their
But what-
behavior.
yes, their behavior, yes. And they have questions too. Okay. So, all right. So doctor, when it comes to we say seasonal allergies, and of course here in the Philippines it's mostly dry and wet. No, we don't have the 4 seasons exactly. In some countries where they have the full like winter, spring, fall, and summer, a lot of people really have these bad reactions during the spring because the pollen and the flowers are blooming, and in the winter it's like heaven for them. Well, it was for me because everything was dead. Okay, but when it comes here, how does the change in weather or our seasons affect us also? And do you notice like when is our allergy season? Are there several here in the Philippines?
Okay. So actually, in our country, we also have the pollen allergies. So it's usually yung pollen sa atin are the ones that, when you say, yung mga pollens that actually cause allergy are the ones that actually grow sa mga vacant lots, ganyan.
Mhm.
If you do like going on hikings, yan, yun sa mga big areas, no? Kasi usually yung mga pollen that we test actually are yung mga talahib, diba? Like that, no? Actually, Bermuda pollen, Carabao grass pollen, Macahiya pollen is actually part of our allergy panel. They've also noted some allergies to yung mango, diba? There are so many mango trees. The flower of the mango tree, mango pollen, yan, acacia pollen. So, these things actually, how they cause allergies, kasi remember, they just grow anywhere, no? Usually, no, the mga weeds, diba? So, ito yung na-fly away or nalilipad talaga ng hangin. And usually, during the season of bare months, yung tag-ulan and mahangin, that's when they grow. Kasi
Yes.
maulan eh. So, di ba kung mapapansin mo, if you have a vacant lot beside you or malapit sa inyo, nakikita mo pag tag-ulan or bare months, that's when they really grow.
Yeah.
And that's the allergy season in our country.
Yeah. So I remember like November used to be like a bit like of an itchy time because of the grass pollen. Here
Yes.
naman, when we talk about pollen, it's okay. It's mostly the grass pollen, or maybe, as you mentioned, some of them, just recapping some of the, some of the, not exactly the fruit, but the flowers of the trees. Like, so it's different kinds. So mostly it's during the burr months, but it can happen. Like, how does the weather also affect maybe some of our allergies? Because sometimes during summer people just break out, and like they are people who know they're allergic, and there's always like there's a March or an April where it's really, really hot, and this is can you be allergic to your own sweat, or is it just like a reaction of acidity?
Yes, but remember, I guess what you're saying is that during summer months in our country, that's when atopic dermatitis or atopic eczema, that's the time naman that this usually comes out. Kasi in our country, very humid talaga, and we sweat a lot, and sweating is an irritant to the skin.
Okay.
If you have your itching during summer months or when it's sweating, you have to check kasi baka you have atopic dermatitis or atopic eczema. Di ba iba nga, actually yung
Yes.
term may hika sa balat. But actually, that's a misnomer kasi ang asthma or hika, it should be at the lungs, no? Kaya lang sometimes kasi yung mga taong may atopic dermatitis, meron din silang asthma. So parang kinokorrelate.
Skin asthma. Di ba, I've heard people say skin asthma. So there's no such thing, but it's just a term that's used in
Dermatitis, yes, or atopic
your
eczema.
infection.
And these people, during summer, yan talaga flares nila kasi sobrang init summer.
And also for the asthma. So also asthma is actually an allergy.
Asthma, there are different types of asthma, okay? One type and very common among the asthma is the allergic asthma. So not everyone naman ng asthmatic is allergic. Pero that's the reason why you always do the history as well. Kasi some of this, especially for the kids, you'll catch them, initially they'll have allergic rhinitis, or when they were younger, they had atopic dermatitis, and then eventually they'll have the allergic rhinitis and allergic asthma. They usually come hand in hand. So usually that's what we check. Pero may iba kung nakukuha talaga that even if you do the skin test, talagang it's negative, and by history, talagang asthma lang. They don't have the atopic dermatitis, they don't have allergic rhinitis. Pwede naman that it's just asthma in general, not necessarily allergic.
Okay. Thank you, doctor. And you mentioned, the skin test. So let's get in a bit into how you diagnose, how you diagnose allergies. And so, you already mentioned the skin test. Can you describe it for those of us who haven't?
Okay, so basically, so you haven't had your skin test yet. No, but I think you should.
I have, but
okay.
I want you to describe the process.
Skin test kasi it's just it's a prick test actually. So it's not an injection. Kasi most of the people, they correlate it to how they do the skin test antibiotics when they were admitted. It's just a scratch test. So basically, they have the allergen. Some of them, they drop it, or some of them, they put the lancet on the allergen itself and scratch. As in scratch lang. It's not an injection, just scratch. Okay. And then after 20 minutes, we'll wait for what we call the wheal and flare. Mamumula or magpapantal dapat if it's allergic, and then we measure it. So that's the allergy skin test. Now, the allergy skin test covers, or what we have we have two types. You have the inhalant or aeroallergen skin test, which includes your pollens, all the inhalant, so pollens, dust mite, dog danders, cat danders, cockroach, yan yung component niya, inhalant, and food. So it depends on your history or what we think you're allergic to. Kasi sometimes if you can eat naman anything, you don't have problem with food, then we don't have to do the food allergy testing. It's just the aeroallergen or inhalant allergen skin test. So it depends on the history of the patient. Iba yon sa naririnig nyo na patch test. Kasi sometimes pumupunta sa amin, doktora, magpapapatch test kami.
Okay, what's a patch test?
Yeah, the patch test is what the dermatologists do. But this is monitoring more for what we call the delayed type of reaction. It's for allergy also, but it's allergic contact dermatitis. And the components of a patch test are usually mga metals, like yung mga jewelries, perfumes, makeups, hair dye, yon. Kasi ang presentation nila usually is the delayed type of allergic reaction.
How about rubber? Like rubber, that's also a patch test?
I believe it's a part of their also, of the patch test. It's what the derma does. So usually with co-management, it depends. Although usually yung mga ganitong pinapatch test, ang presentation naman la skin.
Yes.
Yes, or atopic dermatitis. Yeah.
All right. So, doctor describe what you described what I went through perfectly, which is like I guess on my what do you call this, the inside, I forgot the anatomy more than I do, like inside your forearm, that area, usually, or maybe sometimes they do it on your back also.
Yes, the back, pagka smaller lang yung forearm, or let's say you have rashes on your forearm, so we do it at the back. Or kids, kasi yung kids, ayaw nila nakikita kasi meron silang fear of being pricked.
And the prick,
so I would do it at the back. Pero ideally, ako personally, and if it's older, I prefer talaga the arms kasi nakikita nila.
Yes.
So measure it
and then see it yourself and be like, yes, this is it. So
self-realization.
Yes. So basically, it's like, yes, those experiences were either they use a dropper and this is like cockroach egg, this is grass pollen, this is dust or dust mites, this is blank, this is food, this is fish, this and that, and then the prick doesn't hurt. Nobody likes a prick. What prick hurt? The prick doesn't hurt, and then you kind of you prick it like a scratch. You don't really feel it. So I just want to encourage people out there who haven't done it, don't be afraid of it. The other test you were describing for antibiotics, that is where they
They inject
Sometimes you need that in the hospital. Yeah, it hurts a little bit because they kind of have to dig under your just the top
under the
layer of
skin
your
part.
skin a bit.
Yeah.
Yeah.
Subcutaneous is what we call it. But I
Yes.
have to mention pala, now we also have what we call the allergy test, but also blood done via the blood
Yes.
test.
Can
Right.
you describe that to us?
Yeah, this one naman, we usually prescribe it for patients who really cannot be off medications. Kasi
Mhm.
the specific test, you have to be off the antihistamines for at least 5 days. Kasi
Mhm.
antihistamine nga, of course, it will block the reaction, di ba? So that's the reason why we have the blood test. Actually, maganda yung blood test kasi it's easy. The problem really here, well, okay, again, yung cost, no? Kasi you know naman how our healthcare works, di ba? Usually it's out of pocket, and even if you have
Yeah.
insurance, very limited. So that's just the ano. Pero we do have the blood test for those who really cannot undergo the skin prick test. No? Like example, patients who have disabilities, so kaya really bad atopic dermatitis, we don't have a site. So we really have to request for the blood test.
And perhaps patients who are like, it's just developing now and they really don't know what they're allergic to. And even if you've been doing some elimination from their diet or,
Right.
sanitizing the house, like it could be anything. So if they're reacting to it and they're in danger and they can't be off the meds, and as you said, persons with disabilities also,
Yes.
then you can do the blood test. And is that more accurate than the skin test?
It's the same. They're equally the same.
Okay.
So actually, it's more of preference lang. Faster lang kasi talaga the skin prick test. You do it now, in 30 minutes, you have the result.
Okay.
The blood test, usually there's di ba, waiting time before they run it eh. Kasi konti lang yung nagre-request. So, syempre, para economical, medyo puno
Yes.
sana yung team before they run it. Right?
Yes. Actually, they were running, I remember like 10 years ago, they were running blood tests on a number of people who had really bad allergies or like they couldn't identify. And, there's also a psychological component to it for somebody who has had anaphylaxis, who has experienced it, or it's really, it freaks them out to not be on medication.
Yeah.
And, to just have this happening all the time and having to wait, and I'd like to emphasize what you said, about you have to be off your allergy medicines, whether it's a nasal spray or
with the nasal steroids you can. With the steroids, you can basta inhalation, nose or puffing if you have asthma, pwede. But you have to be off, syempre skin prick test, topical, yung pinapahid na steroids, yan, dapat off.
okay.
And antihistamines.
And antihistamines? Sorry.
You have to be off.
Yeah.
Yes. Antihistamines, you really have to be off. Yes.
Yes. Yeah. I once went, I will not mention the name of this allergy doctor, but and not in your hospital though. I once went and checked on my allergies, and I said, I just happened to be there. Let's check it. I said, okay, but I am on an antihistamine and it's actually only been 3 days since I haven't taken it. Pwede na yan. Oh, so what happened? It came out negative on the skin test, pero I react to it. So I was like, not a good doctor, wasted me and my time.
It depends Just to be, sige. Baka
sige.
we're also the short-acting ones, like yung minention mo na kaninang brand.
No, I was on a set.
It was long-acting.
Yeah.
Okay.
So I was like, okay, so there. So at least you see, with you, Dr. Aquino, and other allergists or allergologists like you want to get to the bottom of it, and you want to get patient relief. So
yeah, that's the reason why we're doing it also. It's not just kasi sometimes you see patient na, nagpapantal ka. Huwag ka nang kumain ng manok, itlog, everything. They just stop all the top or common allergens. But remember, if this patient, let's say it's a kid.
Yeah.
And then you remove it just because nagkaroon siya ng rashes, diba? So, paano naman yung nutrition nila? And like egg, it has very good protein content and now a very good source of vitamin D. If you take it out from their diet, then of course, diba, it will cause more harm eventually kung hindi naman yun yung culprit. So that's the reason why we really prefer talaga the patients na refer to us so we can do the test and of course educate them properly. Yun din kasi yun. Education is key for any health disease. Now, there's just so many information now, diba, with social media.
Yes.
But you have to know which is the correct one.
Yes, you do.
Yes.
That's why it's better to go to a doctor like yourself. And also, I hope this show can really be a platform to get proper information and correct information from doctors like yourself. An actual doctor who will not risk your reputation by being like, hi, I'm so and so, and by the way, yeah. And I'm a very inquisitive patient. It doesn't matter what illness it is. So Nick, I see I'm torturing you a bit now. Do you feel tortured? No, please don't come back anytime.
Talk.
Sorry, what's that?
No, I'm enjoying the conversation.
Okay. Oh, thank you. I'm enjoying it as well. There's so much more I want to ask you, but sige, let's no. You have to control me. Okay. You have to control my my symptoms. We
Yeah,
have
it's okay. Yeah, sige. Because I'm sure naman what we're discussing is very informative. And actually, these are the ones that are actually commonly asked by
Yeah.
patients as well. No? So, kaya, but we also like doing yung mga ganito to, example na lang. For example, until now, I still see patients who develop parang allergic reaction and then kumain lang po ako ng asukal. So even until now, see, I was still a fellow in training at the time. I've heard of this, but really, until now pala, there are people who actually do it and believe in it. Okay?
Yes.
So, yun yung, ano rin kasi, but we really wanna correct. What else? Very common when patients, they develop, a lot of wheals or hives as general. Usually, they go to the ER kasi for fear that they might develop anaphylaxis. Yung mga
Yes.
ganyan. So, you want to help patients not to calm themselves, not to panic. So let's say simpleng rash lang naman for now. If you're not having any other symptoms, you can take an antihistamine and observe yourself. Then you see if it's really getting worse, and that's the time that you go to the ER. Parang ganon, di ba? Para less din yung exposure nila. Especially now, there's so many sick people. And allergy is not really a contagious disease, So it's something na if it's not delicado, it's something that and not an emergency, as long as it's not anaphylaxis, it's something you can see in your clinics naman. But it's not also too hard for them.
Yes. Okay. Then I want to hone in on the two things you mentioned. One is the kumain ng asukal. So a lot of people believe that if you're having an allergic reaction,
You take
sugar, it acts like an antihistamine. It'll help
Yes,
it.
it's what I don't know how it talaga. Yan, and actually believe it or not, lizard, butike, meron palang ganon.
So,
I
okay,
don't
I don't think
but I've heard of that. Pero so far, thank God, wala pa naman naging patient ko.
butiki raw or cooked?
I don't know how they do it. Sabi ko talaga, alin ba doon, may kinuha bang part or something?
Yeah.
Pero
Baka
parang
yung buntot lang because it will regenerate, Okay. And do you chew? No, okay. But
ganyan.
I just, my own personal opinion is maybe, like when people have tried to calm me down by taking sugar, I think it's the sugar high can help you calm down because with an allergy comes the component of also getting anxiety, especially if you've had bad allergic reactions. So maybe for some people, if you've got like fluctuating sugar or, the sugar makes you a bit happy.
Yes.
It's not a bad thing, but you do have to take the antihistamine or go to the doctor or whoever and treat it with the proper medication.
Right.
And then, okay, now I'm thinking of the butiki. Okay, the other thing you mentioned was, okay, so if we have rashes, did you mean to say that like because when we have a hive on top of our skin, there's also something under, right?
The redness?
I beg your pardon?
The redness, yun ba? Mapula, it's red, very itchy.
And then, underneath, is there also like, I don't know, I guess like from before I heard that there's also like a kind of hive under your skin. I mean, of course there's a reaction happening under the skin that you cannot see. Okay.
Some people kasi, they have really bad reaction that aside from the wheals, they have what we call angioedema, yung big eyes and big lips, diba? That's what we call the angioedema kasi parang the swelling is very deep. Okay? So it's still a part of the reaction, of the allergic reaction. And usually, these ones kasi, it takes time before they are gone. Unlike yung mga common wheals or hives, medyo mabilis. Some of them, we take antihistamine, tapos mabilis sila, di ba? In an hour, mawawala. But yung swelling, angioedema, or yes, yung iba, parang maga after, di ba? Under the rash, it usually takes longer to heal. So if that's the case, usually those are the ones who really seek consult. So we just sometimes add medications if we really have to. But
Yes.
to check kasi sometimes some of these patients who really have a more severe reaction, like hindi lang siya wheals. Yun nga, may maga after or may swelling under. There must be something else that caused the reaction. So usually we check for those as well.
Also, doctor, maybe for those out there who have had bad allergies or have had experience with anaphylaxis or something, approaching it, sometimes because it starts with like an itch, and then you get all of these hives. Okay, and then you get and then your face starts to itch, and the swelling of the lips, the swelling of the eyes, and then it can really change the way you look.
Yes.
Then you've taken the medicine, but then you have difficulty breathing, and then you start throwing up, and then those are signs
Yeah,
of
that's anaphylaxis na.
that's anaphylaxis already.
That's
So
anaphylaxis na. I guess a simple way of saying it, and this is how I teach, even those who are in training, anaphylaxis usually comes with two organ involvement. Meaning, you have skin, rashes, maga, and difficulty breathing. Kahit nga feeling mo parang choking sensation, okay na to go to the ER. Yeah.
go to the
Or
ER. Exactly.
parang you had rashes, wala naman difficulty breathing, pero you vomited or
Yes.
had diarrhea or both. Yan, go to the ER na. It can be anaphylaxis kasi 2 organs na siya.
Yeah.
Oh,
It's more than one organ or system.
Yeah, 2 organ system. Or pwede naman, you're allergic to it, pero nakain mo pala for some reason or you were exposed to it and you just kind of feel different, just go to the ER na. Kasi sometimes, anaphylaxis can also present as just hypotension or bumaba lang yung BP mo.
Yeah.
Yeah, after exposure to your known allergen. So,
Yeah.
I guess ang pinakaano nga with anaphylaxis, kasi often we get this at tatawag doktor kasi we're not sure if it's anaphylaxis. Okay lang yan. If you're not sure if it's anaphylaxis, pero it might be anaphylaxis, then you can give your epinephrine. Okay lang kasi the patient's at the ER already.
Yes.
And then you can also monitor the vital signs. And what the practice parameters for anaphylaxis are saying is that if you see that the patient is kind of getting worse, parang may iba, hindi talaga then just treat it as anaphylaxis. Okay lang. Kasi the epinephrine that we give is intramuscular. It's not via IV. So yung risk of it, kasi the epinephrine can also cause parang arrhythmia to the heart if mali.
Yeah.
But since you're giving it via the muscles, it's not, it doesn't really cause any heart problem. Na grabe. Yeah.
I'm so glad you mentioned that, doctor. I mean, because it really when in doubt, and if you feel really different, go to the ER. I mean,
Yes, all the
not
time.
to be a total alarmist, but you have to, instead of just wait till tomorrow. Yeah, you could be dead in 30 minutes. And the thing that you said, giving it intramuscularly,
Muscles at the thigh, because it's the biggest muscle mass.
that's with the EpiPen, no? How about with the mano, the epinephrine?
Same, it's still the thigh. That's what they studied kasi Kasi hindi ba pwedeng sa arm na lang, mas madaling itaas kasi, di ba, and shoot it there. Pero, it's a smaller muscle mass here. So, if you give it to the bigger muscle mass, syempre, the absorption is faster.
Okay.
Kasi pinakamalaki yung muscles mo dyan.
And I know with the EpiPens, I mean, when I lived abroad, they gave me an EpiPen.
That.
I mean, it can rip through your jeans. Because you need it. I mean, are the EpiPens here like that?
All the EpiPens, the EpiPens that we buy are the ones that are actually being sold in Australia.
Okay.
Same. Yeah.
And
local EpiPen made, malapa
with the mano, I know it's like, there's this glass like thing in the top.
Yes, then you have to open it. Yeah.
When you're already panicking and like, I can't breathe. Like
yes, that's the problem then. And some parents, that's the problem also. Some parents, plano na pagtakot sila, nagpapanik sila. Sometimes they get the whole contents of the ampule and inject it on the child.
Yeah.
Actually, yun yung mga dangers with the mano-mano epinephrine. So anyway, may option naman if they wanna buy. The problem lang talaga, it's just really expensive. Diba? Nasa mga 10,000. Tapos the expiry is quite fast.
Year?
Yeah, parang mga a year or 2.
Yeah. So,
why other for the mano-mano?
I hope that the our public health system also improves, because
Yeah.
people should have access to this. I mean,
Right.
they should have access to a lot of things, but these are really life-threatening
Right.
things.
Correct.
And also, as you
Correct.
said, educating, when you don't have access to medicine and things like this, you'll eat sugar, lizards, whatever.
Actually,
Um,
I think even in the States, diba,
yeah,
the EpiPen is actually expensive eh.
it
I've
is.
s- yeah, ang good thing lang, most of the people, they can buy it through their insurance.
Yes. And it's not like, but
They,
it's also not super, super duper expensive. I mean, 10,000 is a lot for us here, okay? Because we we earn in pesos and we're
yes,
spending in another currency that is doing much better than ours. For when you're living there and you're earning that currency, it's not yeah, it's expensive, but it's not such a big expense like that's your whole salary. Or
yeah.
that means minusing things from the table. What happens here is, okay, I'm not gonna go. I'll just say one thing. I really feel for people, and especially for seniors and those with illnesses, when you have to choose between food and medicine. I hope that can be fixed.
Yeah.
Country.
Hopefully.
Okay, that was just okay. So,
Yes. A
uh,
frustration. Correct.
you know, you gotta choose between this or that. It's not like you're choosing between a T-shirt and something. No, well,
Health.
okay.
Correct.
Health. Okay. So, doctor, so you know, you've explained to us how to diagnose allergies or how you do it, and then maybe the best ways to do it, the blood test or the skin test, which you will see much faster. You did mention some things earlier. I I didn't want to interrupt you, but I remember it now. You said the allergy should also be kind of, if you're actually allergic to something, it usually comes out within 30 minutes to an hour, right? Or sometimes immediately, like in 5 minutes, or like, "Oh, I'm allergic to it." Or somebody injects, you rush to the hospital for one reason, then oh, you have an infection. Somebody injects an antibiotic straight into your vein. Suddenly you can't breathe. So if it's a true allergy, will it show up right away, or can it still be delayed?
Yes, there are some allergies that are actually delayed.
Mhm.
For example, if you're really allergic to it, like food actually can come out as late as mga 4 to 6 hours.
Mhm.
And pwede naman. But usually the severe type kasi usually comes out faster. Like pag
Awesome.
anaphylaxis usually faster. And what else? I said that allergy, you develop it eventually. Like for example, antibiotics. Doc, how can I develop allergy to it? Parang day 5 ko nang tinitake to. Ngayon pa ako nagka-rashes, patapos na.
Mhm.
Kasi exactly, that's allergy. Sometimes you develop it over time. Parang you need exposure, or what we call the period of sensitization. Na-expose ka muna. That's the time you develop your IgE antibody. So the next time you encounter it, dun ka magre-react. Pwede talaga. What else? For example, nag-allergy ako with this antibiotic. Dati ito yung common na pinaprescribe. I commonly take this. Bakit now nag-react ako? Kasi pwede yun, no, na because you took it before, then you develop antibodies to it after. So the next time around that you took it, that's the time that it reacted. Pero ano ba? But usually it should, yes, immediate, especially for the severe type. Pero it can be on a little time. Pero I don't think it should last as long as more than 12 or 24 hours. Medyo late na yun. So kung matagal na yung exposure from the time you took it, then maybe it's not. Pero food, it's reported it can be mga 4 to 6 hours. Pwede.
Okay, thank you, doctor. And also, I'm glad we talked about medicines, because medicines, whether they're over the counter or prescribed, you can be allergic to that.
Yes, any medicine actually can cause an allergic reaction. It doesn't guarantee na you took it before or most people take it, pwede ka pa rin talaga mag-react. Actually, most common cause of an allergic reaction sa medicines are the pain relievers, NSAIDs, and antibiotics.
Yes.
You're commonly exposed to it, or it's commonly prescribed to you. So very common. That's usually severe then sometimes, especially if the medication is given via IV, mas reaction nila kasi via blood compared to just the oral one.
Yes, the NSAIDs are the non-steroidal anti-inflammatory drugs,
Yes.
which be all over the place.
Right.
Yes. And then there's also like penicillin or aspirin, which we
It's
also see
very
all over
common
the place.
penicillin
And they mix a lot of meds, so you gotta be careful. Like you're okay with one thing, but they decide to, and plus this, or like let's say it's a feminine thing for like it's supposed to stop your hi Cosine, it's supposed to stop your cramps. Like I was like, baby, careful because
Oh, okay.
they add the component of something else there that you're actually allergic to because they add another pain relief thing.
Medicines are delayed type. Yun nga yun eh. Kasi like I remember, just like what you were saying, I used to have also bad migraines from my monthly period.
Yes.
So I used to take talaga NSAIDs every
Yeah.
time I had it. Then all of a sudden, I was attending a wedding. Doon pa talaga ako nag-start mag-angioedema. So hindi ko pinansin. I wasn't an allergist then. I wasn't a doctor yet.
Yeah.
The next time around I took it, it was getting worse until eventually I took it again. I had difficulty breathing. So yun pala, it's really an allergic reaction. So see, that's how it is. Over time that you take it, it really worsens.
Okay. I have so many more questions for you, but I'm told we're running out of time. Doctor, can you
Okay.
please guest again? And also, can I get your number after the show if you can just type it in because
Yes. There's actually a lot of allergists in Makati Med. So we are very happy to help everyone who has allergy concerns or allergy questions. You can always call our trunk line to connect you to an allergist who's available at the time you're available. And I hope it's okay. I'd like to, since you're
refer us to others.
about allergy, I'd like to invite you and all our listeners and people watching us. Since July 7 is really the National Allergy Day. So
Okay.
on Sunday, we are having, it's for lay, fora. We will discuss the different types of allergies. It's going to be at Fisher Mall at 2 p.m., 2 to 5. So it's free. So just drop by and learn about allergies. So you're very welcome to join us. Some of the allergies will be there, and we have allergists who will really discuss the common allergy diseases.
Mhm.
So please join us.
Okay, they're gonna kill me with all my questions, but it's okay. I guess that's what
But
you
it's
guys.
okay, kasi that's why we have it eh. Actually, proclamation siya ha. It's really a law. Then July 7 is really National Allergy Day. So it's a yearly thing. And we're just really grateful that finally, after the pandemic, we're having it face-to-face because we used to do it online. And it's really hard for the reach, di ba?
Yeah, it is.
Right
It is.
now, a lot of people can watch really and be there to physically ask your question. It's really different, di ba? Teaching face-to-face versus
And
online.
sometimes there's something to show someone like, what's this? You know?
Yeah. Yeah, so please join us on Sunday. I'll be there.
All right. And then doctor, if I can get your number, and don't worry, the patients I can refer to, if your schedule is too full, you can refer them to allergists whom you trust as well.
No
And we do need more of that. And we do, I mean, when I say we, I mean my own community, we do need to do that and go and get our checkups and stuff and get updated and double check. So thank you. Is that all you'd like to say? Would you like to say hello to anyone? Floor is yours.
Thank you so much. Of course, thank you for having me, and thank you for always partnering with Makati Med to get the best updates, and of course, for all the listeners to be well informed of the different diseases.
Thank you so much, doctor, for being a guest on this show. Please come back more often. Please, please, please. There's so many things to discuss
Thank you
about
for
it.
having me. Yes, definitely, no
We
problem.
could go into each and every topic because, allergy is also a very, you have anxiety when you live with it, and the people around you get it
Correct.
too.
Right,
Especially
yes.
when you're first diagnosed.
That's true.
And it's taken so much for granted.
Yes.
And there are a lot of allergic people in the Philippines, all over the world. Yes, there are a lot of people who have allergies in the Philippines, and a lot of them cannot also afford to really have everything checked. So at least if they get proper information from you, we are doing our part to inform people and help them out.
That's correct. Right.
Thank you, doctor. Thanks for
Thank you
being
so
on the
much, Miss Nicole.
show. Oh, you don't have to call me Miss. Just Nicole.
Okay,
Or you can
Nicole.
say, patient Jacinto, come here. It's your turn. Okay. Thank you, doctor. Please do come back. And if you don't mind, that's for your number after the show. Bye, folks. Thanks for listening to us, for tuning in this week. We'll see you again next week on Healthline with Makati Med. Stay tuned for the next program.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.